Have you experienced pain in your life, or are you experiencing pain, emotional pain in your life? Well, today in this second of our yoga series, talking about the different primary kinds of yoga, today we're going to talk about the problem with pain. See, we're always struggling because we don't want to feel it, because it hurts to feel pain. But also we can't not feel it. We want to push it away. We want to bury it, but we can't do that because that tends to keep the pain alive. So we're always in this dilemma of what to do with our pain. And so today I'm going to help you walk through that dilemma, because it's really not a balance that you're trying to seek. It's really an understanding. If you could have a right understanding of your pain, if you could know how to rightly see your pain, understand what it's doing and why it's there, then you could better be able to feel your pain without becoming consumed and overwhelmed with your pain. So if you want to learn more about how to deal with the problem of pain, check this one out. Yoga Psych. Ancient answers for your current problems. Hello, welcome back. I'm Brett, your favorite shrink. And today we're talking about a special kind of yoga called Jnana Yoga. And it is a yoga of right understanding or right knowing. And I really think of it as the yoga of your thinking brain. So let's talk about what that means. As we've talked about before, we have 4 core minds, or I think of them as 5 minds. But if you lump the outer neocortex together into one thinking mind, yes, we have 4 core minds. And our thinking brain is the brain that we use, most of us use, and most of us really identify with. And in Jnana Yoga, which is the yoga of right understanding, what we have to do is we have to be able to understand what is real, what is true, and what is not true, what is not real. Because it is our thoughts that can actually help us or bind us, lock us up, can trap us. And a lot of the times, the way we think, particularly about pain, we become locked up in our pain. So let's look at a story of a gal called Nancy. Now, Nancy was dealing with some particularly painful circumstances because her husband, Tom, had an affair. And Tom wanted to work on the relationship, and she wanted to work on the relationship. She wanted to reconnect with him as well. The hearts were willing, but the pain was the problem. See, she had such terrible pain from what he had done that it kept her guarded. It kept her collapsed. It kept her walled up. It kept her distant. And so she was in this awful dilemma of either feeling this pain, which was real and legitimate, and it had to be dealt with, it had to be processed, or denying the pain, not feeling the pain, and somehow allowing herself to reconnect with Tom and build a relationship. And it felt like it was one or the other. She didn't know how to do both be connected and loving and open to Tom and allowing herself to be the wife she wanted to be with him, and what to do with this pain that was collapsing her, that was screaming out, that was telling her that she was unsafe and that she had to build walls and she had to distance herself. She had to either be true to her pain or true to the relationship, and neither one felt like a win for her. Well, as she comes into therapy and starts to talk to me about her scenario, trauma and dealing with, particularly with betrayal trauma, is something that I specialize in the clinic that I work with right now at Addo. And so as we start working on her trauma, it becomes really clear to me that she doesn't know how to see her pain in a way that's useful. And I think most of us don't know how to see our pain in a way that's useful. Most of the time, we feel our pain, and we feel our pain kind of as who we are. I'm in pain. I'm hurting. I'm depressed. I'm anxious. I'm overwhelmed. I'm scared. I'm sad. And all of those statements, you'll hear the message. You'll hear the language. The language is, I am. And in Jnana Yoga, one of the things I want to look at is, who am I? And beginning to understand that, having a right understanding of who I am, really helps me, frees me to begin to pursue God or truth or love. Now, if I believe I am my pain, it actually sticks me. It actually freezes me into the problem itself. It doesn't free me, it freezes me. Let me tell you a little bit what that means. The way we need to see our pain is like any state of dis-ease. If I'm in a state of disease, I have a cold, I have a flu, I have cancer, I have diabetes. If there's any kind of state of dis-ease in my body, disease, it's telling me that there's a problem. It's telling me there's something that I need to do. And I need to take action in order to bring myself back to a state of health. Sleep, rest, maybe antibiotics, maybe chemotherapy, maybe even surgery, maybe insulin. But I need to change something to help myself heal. And that's appropriate. And that's something I need to pay attention to. My disease, my illness, my sickness, the pain that comes from being ill is telling me, take action, do something, and restore my health. Well, what if we saw pain from that same point of view? What if our pain was a state of dis-ease, emotional dis-ease? Now, it would be, if that was true, it would be telling me I need to take some kind of action. I need to take care of myself in some way to help myself heal. However, and that's not a problem. That's a good thing. That's a positive thing. However, our problem tends to be that we own and personalize our emotional pain. That becomes who we are. And why that becomes a problem is because then I identify with the disease. And then once I've identified with the disease, I can't heal. I can't get fixed. I can't change because that's who I am. If I'm a tree, I'm just going to keep being a tree. I could want to be a bird in the tree, but I am the tree. And as much as I'd like to be a bird, I'm never going to be a bird because I see myself as a tree. If I see myself as diseased, if I see myself as my emotions, if I see myself as pain, trauma, hurt, betrayal, then that defines who I am. And once I become defined as that, then I become trapped. I become trapped because my brain wants to sustain that. My brain wants to maintain that which I think I am. So if I'm in pain, any steps I try to do to get out of my pain, my brain will feel better for a moment and then return back to the pain because it is who I am. So we don't want that. We want to feel the pain, which is good and healthy because it's teaching us and telling us that we need to do something. That feeling of dis-ease is telling us to move some way so we can move back to a state of ease. But the problem with pain is that we identify with the pain. We see the pain as ourselves. That is the key issue that you can't do. You have to see pain as pain, emotions as emotions, but you can never own them as who you are. So in this example with Nancy, I gave her a writing assignment and I said, Nancy, here's what I want you to do every single day. I want you to think about your pain. Every single day, I want you to engage in a conversation with your pain. Every day, I want you to listen and learn from your pain. Learn what the pain needs to heal, to bring you back into a state of ease. However, I want you to never own the pain. And so, in fact, what we did is we gave the pain a name. We called the pain Polly. Polly pain. And in her journal assignment, what she was supposed to do is she was supposed to write letters to Polly and from Polly. And Polly could tell her whatever Polly needed to tell her. I'm scared, I'm hurt, I'm overwhelmed, I'm confused, I want to push away, I want to create distance, I don't want to be close. Whatever Polly said was fine. Polly's feelings were always okay. But we had to always remember that Polly's feelings were Polly's feelings. And they weren't truth. They weren't reality. It wasn't in this moment that her husband, Tom, is having an affair. In fact, Tom is really working his program to make sure that he's dealing with his own sexual compulsions and making sure that he's not acting out in any way. But that's Tom's program, and he needs to be working his program. For Nancy, she needs to work on her pain. And so she would write letters to pain. And in doing so, she would provide Polly, the pain, the love, the nurturing, the support, the care, the attention that the pain needed to heal. All of us need to heal the pain. And what we need to heal the pain is love. And so what I had Nancy do is give the love. Give the love herself to Polly, to her pain. To be there, to support herself, to support her pain and say, hey, I get it. I hear you. I love you. I understand you. Yes, I know you're hurting. And I'm there for you. Well, the upshot of all of that was that Nancy started to heal. Not because I healed her, not because Tom could do anything to heal her, because she healed herself by giving love and attention to her pain and allowing herself full permission to feel her pain, to express her pain, to be her pain, but not in a personal sense. More to be with her pain. That's probably a better way of saying it. She allowed herself to be with her pain, not denying it. But she didn't let herself be her pain because she can't. She can't own her pain as who she was because then she couldn't heal because then there would be no one there to give attention, no one there to give love. And again, the upshot, Nancy started to heal. Nancy started to find wholeness. And to me, it was the best kind of wholeness because it was a wholeness that came from her. Now, homework for you. I want you to identify your pain, whatever it is, doesn't matter. Your pain is legitimate. Your pain is real. But you can't make your pain you. So I want you to identify your pain, and I want you to start practicing today. Give your pain a name and practice communicating with your pain. Talk to your pain. Give it a name, give it an identity, give it a voice, and allow it to express itself. Allow it to release the energy and emotion that's trapped there. And in that release, you're going to find flow. And it's that flow that's going to give you wholeness. So practice for yourself Jnana Yoga. Understand the right understanding of who you are. Again, I'm Brett, your favorite shrink. Thank you so much for watching, and make sure you get on to yogapsych.com. Take care. Hey, I haven't told you yet, make sure you go to yogapsych.com because that's where you're going to find these ancient answers for your current problems. Take care.